up, Porter County, and welcome to yet another edition of the PoCo Wellness Hour, right here on WVLP 103.1 FM, your voice for local community radio, and your show for health, community connection, and overall well-being. I'm Demetrius Lewis, Communications Manager for the Porter County Health Department. Now, here on the PoCo Wellness Hour, we like to shine a spotlight on the incredible initiatives shaping our community and the powerful partnerships that make it all possible. From local organizations working to improve public health to the innovative programs led by the Porter County Health Department. This show is your guide to stay informed, inspired, and engaged on your wellness journey. So sit back, relax, and let's dive into today's conversation about building a healthier Porter County together. Now, today we have another packed house here at WVLP Studio. I'd like to welcome Scott Jansen, Alyssa Zils, and Samantha Aguilar from the Root Committee of Porter County. How is everyone doing today?
Hello.
Doing great. Doing good.
We
Thanks
really
for having
appreciate
us.
Absolutely. We really appreciate your time here in the studio today. Let's just jump right into it, guys. Can you all just introduce yourselves a little bit and talk a little bit about your roles with the Root Committee? Let's start with you, Scott.
Sure, yeah. I'm Scott Jansen, and I'm a personal relationship manager with Gateway Foundation, which is a treatment provider of substance use disorder services out of Chicago, Illinois. But I'm very active in Northwest Indiana, and I am the chairperson of this committee, the Root Committee, and have been attending the coalition meetings for Porter County, to try to make a difference in the communities here for the last 6 years.
Samantha?
Hi, I'm Samantha Aguilar. So I'm the co-chair of the Root Committee, and I am a person with substance use. I'm living in recovery. I'm active in the community as a yoga teacher, a meditation teacher. I'm also a peer recovery coach, and I've been with the Root Committee since its start and with our supporting agency for about 4 years, which is the Hub Coalition of Porter County.
Awesome.
I'm Alyssa Zils. I am the Porter County Program Director for Mental Health America of Northwest Indiana. I got involved because I came from our Lake County office and then was promoted to run out here in Porter County, and just so happened to come across a group of amazing people in the community who kind of pulled me into this recovery work that they do. So from there, I kind of just taken off with a Hub Coalition and followed the lead of these two and been doing all kinds of good work.
Awesome. That's good stuff, everyone. So for the listeners who may not be familiar with the Root Committee, this may be the first time hearing about it. What does it stand for, and what do you guys do?
Yeah, so the Root Committee is a acronym which stands for Reducing Opioid Overdose Together. And as a group committee, we are looking to make a difference. In fact, I think the easiest thing to do is share our mission, which is working together. Our Hub Coalition will reduce opioid overdoses through education, coalition, collaboration, and community awareness events. And the vision we have for this group that we came up with is that together we will reduce opioid overdose in Porter County. We know that's not a job for one person. We know it's a collective effort, and it's a community effort. And so this committee focuses on collaboration with other individuals in the community and how we can make a difference by, getting the word out and reducing stigma.
So how long has this committee been established?
Well, the committee was established back in October of 2022. And how this was born, if that's something I think that is important. We were doing work with a harm reduction committee, and every effort that we were making in this direction with the opioid crisis in full gear, full swing, we wanted to make a difference and stop the deaths that were happening and try to provide resources to people. Obviously, to lower these death numbers of opioid overdose fatalities by providing resources and just, helping people understand the risks that were involved. And we discovered that there was a vending machine option for a distribution of naloxone, whereby the state of Indiana was going to provide funds for this as a vehicle that we could perhaps display somewhere in Porter County where people could have access to this. Turns out the vending machines were spoken for, and so we had to find a different direction. And ultimately we came up with Root as a way to start a committee for people that specifically wanted to be engaged in this effort to start putting naloxone boxes throughout Porter County to reduce stigma, provide access, and also education on how people could, use these resources.
Can we go a little bit more into why the Root Committee was created? Was there a specific situation or something that happened that kind of made the committee form?
Well, I could give one stat, and I think if Samantha or Alyssa would like to speak to that as well. According to the CDC data for Porter County in 2022, Indiana is a state that out of 50 states was ranked number 39 in terms of overall overdose deaths. We saw from 2008 through 2023, there were 632 fatalities that involved substance use, 484 of them involving any opiates. And so obviously this is a problem that we can say is, it's not in my backyard, people want to say, but it is. And it's happening. And as far as we were concerned, one death is too many. Okay?
Understood.
But the fact that you had 484 deaths, what could we do to make a difference? Because as a coalition, the Hub Coalition, we're all about providing wellness, health, and a drug-free community in Porter County for our families, our children, and friends. And so this effort is an effort that we started to try to make a difference to reduce those numbers and see people have healthier options and healthier choices. So.
To add to that, with the data, we also, one way we started was, okay, where would be a good spot to put one? Where do we start? So we use the Indiana.gov website where you can actually go back and use heat maps to look at the number of EMS calls that were provided in certain locations for an overdose. And we use that heat map to kind of see where those hotter areas were and what businesses or organizations are in those areas that maybe we can approach to meet the need where we're seeing it. So that was like a big guiding factor when we were trying to look at where to place them.
That's important stuff right there. That's good information. Let's talk a little bit more about the opioid crisis in Porter County. What are some of the opioid-related challenges that we're currently facing here in Porter County? I'll start with you, Alyssa.
I think it's still the stigma part of it. From the mental health perspective, because that's what I kind of bring to this committee, is most people don't wake up and decide, I'm going to be addicted. I'm going to venture this. It had built up to that. Something had happened. So we have this stigma still that it's your problem. Like, you could just quit if you want to quit. Not understanding that it's such a process and there's so much deeper to that. So trying to be able to get that out there and break down some of that stigma with the education we're using, that this is a disease and it's something that people really need help with.
Can you talk a little bit about why this initiative is so important for our community right now, Porter County specific?
We have a very high drug rate in this area. As LaPorte County next to us, like this area, like we have a lot. It is a problem. I know when I did foster care for a while, and all the cases I would see that came toward, it was drugs. It was always drugs. So we do have a problem in this area.
So I've been in Porter County about 2 years now. I celebrated my 2-year anniversary last month in April at the health department. So I'm pretty familiar with Porter County, being out here 2 years now. But is this a recent issue, or is this something that's ongoing in Porter County in our community?
I believe it's something that's been going on for a while, and it's kind of across the country, really. But we do see it prevalent here.
Okay, understood. Let's move on and talk a little bit about Naloxone Box, the Naloxone Box initiative. So can you tell us a little bit more about what the Naloxone Box initiative is? I'm looking at your flyer right here, and sorry for you guys listening on radio. You can get this information from the Hub Coalition Porter County webpage, but we wanted to talk a little bit about the naloxone initiative mentioned on the flyer. What is it and how does this work?
So our Naloxone Box initiative started from what Scott had mentioned about wanting to get a vending machine, and there was no funding available, so we had to pivot as a coalition to figure out how else could we provide these resources in our community. And so that we'd kind of come across these nalox boxes, and so our funding is through Overdose Lifeline, and Overdose Lifeline is a really great nonprofit in Indiana, started by Justin Phillips, and she had started this nonprofit and was giving out this funding for these boxes. So it's a container that holds naloxone doses or kits in public spaces that are accessible 24 hours a day for naloxone to be picked up at any of these locations with no personal interaction required, no identification needed. It's very anonymous. And so these boxes, they aren't locked, they're outside, it's okay with the elements, and we were able to begin this with that funding.
So they're available 24 hours a day.
Yes.
Can you tell the audience a little bit about why this is so crucial? Why are these boxes available to the public 24/7?
So starting to work with stigma is something that we kind of have to take a outside view. So we can't just look at how naloxone is available through EMS and how it's available now over the counter or through a prescription, which is how it was when we originally started. It was only available through prescription or EMS. So now, even though it's over the counter, we still have to work with the community to address the overlying stigma going on. So by bringing these boxes out and having this being able to be accessed, we're telling people, hey, you're a real person, we care about you, you shouldn't have to go through these hoops to get a life-saving medication. So having it available 24/7 is allowing us to kind of get a better interaction with a community that is using substances, or in the community in general, where some people might have never used, or somebody may have taken too much of their medication, or a child might have gotten into something. And so we're not having to call or go through these hoops to get naloxone. It's readily available in our community.
Understood. You make a good point that an emergency or any of these kind of situations can happen at any time of day, any time. So that's a really good point there. Sticking with that, how can someone recognize the signs of an opioid overdose if they are maybe out in public and there may be someone who are showing those signs of distress? How can we pick up on those signs?
So we offer naloxone trainings, and in that training I do tell people that an opioid overdose looks very similar to any other medical emergency, which is why it's very important to still call EMS. But some things that do differ are the pinpoint pupils, the slow or no breathing. So other medical emergencies, people might still be breathing, whereas an opioid overdose, it's very hard to detect any breathing. Blue lips, fingertips, clamminess. So it does look similar to other medical emergencies, but those things like the pupils, the breathing, and the blue lips or fingertips help distinguish it a little bit more.
Awesome. And you say you offer trainings for this kind of, to spot this kind of stuff?
Yes. So those trainings could be just for the naloxone, or we also offer like anti-stigma and stuff like that.
How many naloxone boxes do we have right now? How many locations?
We have 23 nalox boxes in Porter County now.
More than 20. That is awesome.
Yes.
And are we still growing? Are we hoping to get more on those?
Yes. So we have a few in stock right now that we are looking to place in the community. And then we just received more funding and we're able to purchase 10 more for the year of 2025.
Okay. So 10 more coming to Porter County, right?
Yeah.
Awesome. That is good work, guys. Let's talk a little bit about education and training. We talked a little bit about that, but what kind of education and outreach programs does Root support to raise awareness about opioid misuse in Porter County?
So we offer our naloxone trainings, which we curate to the community. So if there's children involved, we can make it a little bit more accessible for children to be there. We can make it so we've done it at schools before with the teachers. We've done it for police departments. We've done it for mental health education. So these naloxone trainings aren't always like the same. We can curate them to whoever would like to have them. And then we also offer anti-stigma education, harm reduction. Not everybody knows what harm reduction is, and it varies greatly. It's a big spectrum. So we offer those trainings along with not only what is naloxone, but how to administer it and how to recognize an opioid overdose and how to move forward from there.
Good stuff. Can anyone be trained to use naloxone, and is it difficult to administer?
It's not difficult to administer. The naloxone that's in the Nalox boxes that we offer is nasal naloxone. So it's just like a Flonase, but there's only one dose. So we go over in the trainings about how since there's only one dose, we don't want to spray it to make sure it's going to work. We want to make sure that it's in their nose, and then we can press the plunger. But it's very easy. It's just like any other nasal spray. Very easy to administer, easy to use, easy to train people.
So we talked a little bit about this off air, but can you kind of point out what, the Narcan versus naloxone? Can you talk a little bit about that terminology?
Yeah, it's used interchangeably a lot, which is fine, but as we are getting more funding and it's getting more popular, it's probably good to note that naloxone is the medication, whereas Narcan is a name brand, and there are other brands of naloxone coming out. But in Porter County, because we're using Overdose Lifeline funding, we are using Narcan naloxone.
Okay, thank you for clearing that up. If no one else was confused, I was confused. So, thank you for answering that for me. Let's talk a little bit about measuring the impact of the programs and initiatives that you guys are a part of. So, what kind of results or impact has the Root Committee seen from these initiatives like Nalox Box or community trainings that you guys host?
So, I'll have Alyssa talk a little bit more about some data that we have about doses we've given out. But overall, the trainings have been really great because we're working with stigma. There's been so many myth-busting moments in these trainings of people asking questions, and they're just really genuinely not sure. So I am someone living with substance use disorder. So having that interaction with people and being able for them to ask their questions of somebody who has experience with substance use has been helpful as well, because there was a ton of myths in the community about like overusing naloxone or selling it, or just overall just those stigma barriers that come along with this. So there's been a lot of really great conversation that's happened from these trainings in the community, especially like we've done them at the YMCA, we've done them at Hilltop, we've done them at all these places where just normal community members can come in and figure out like, hey, we want you to have a say in what's in your community, so let's give you all the education that we can give you and answer any of these questions so that we're all comfortable with what's going on. So the trainings have been great, and then overall the resources with naloxone, people all the time. I was just on a phone call earlier where a friend was telling me, I'm so glad that I have this bag of naloxone at my house that if I can just bring with me, because I have friends with substance use, and they called me worried literally this morning. And so she was able to go and meet her friend and just be there for her, but have that naloxone on her just in case that was part of the emergency. And so I know we have a lot of great data with that as well about doses that we've given out.
Yeah, so when we started, we began in October 2022, so that's where it kind of started. So we weren't really putting too much Narcan until we started getting those boxes out in 2023. So our first year, we were able to stock 519 doses across the county. And then in 2024, we did 480. And as of right now, we are at 104 doses this year.
That is awesome. Good numbers right there. So Sam, you talked a little bit about your story, but can you or anyone here share a story about where access to Narcan, naloxone helped to save a life, whether it's someone that you know? Is there a story, of course, not to get too personal or anything, but do you have a success story that you can kind of share about how this naloxone program has helped an individual or some?
So, to keep anonymity, of course, I definitely know that because I'm in recovery and in that field still, I know quite a few people that come to me for naloxone, or we also offer fentanyl testing strips, and that's a great way to reduce the stigma of substance use as well and help with an opioid overdose and avoiding that, because some people are not aware fentanyl isn't a substance they're using. So I have quite a few people that have come to me thanking me because something came up positive from a testing strip and they did not use, or that they they've used naloxone and it helped in an emergency. And there was a training that we did where someone had shared about actually an overdose happening in their cul-de-sac, in their area where they live, and they were able to call EMS, come over with their naloxone and just be there, and they knew what to do because of a naloxone training. So that was a really great story. I mean, I'm sure there are plenty others that people don't tell us about as well.
Yeah, I would say that's a really good story. Yes?
I will say that what I have seen is not necessarily a life-saving experience, but I have noticed with those who I've told, like, we have this and I have access because I have one in my office, the relief they have and show, like, oh, can I have somebody to keep on me? Because they know people, and it's so nice to be able to have, like, that ability to carry something out, because it's kind of a safety net. Like, I have this on me just in case I run into somebody because I know people. So it's a positive thing there when people are happy that they're hearing that this is something that they have access to. Because when we were doing this work, we learned that police several years ago were required to start carrying it on them, but that's all that you saw. So how do we get this into the hands of the public so that they have this life-saving option? Because sometimes they're afraid to call 911. What are the repercussions? What are the legal consequences to what I've done? So this helps with that life-saving, is that people have access to this and don't necessarily have to worry. Yes, we still need to call 911. I'm not saying don't, but sometimes that is the fear of calling, is what's going to happen because I did this. So this helps there.
Mm-hmm. Yeah, and through this committee, we have members, we have people that were in the committee that are no longer or have gone on, and they've done great things too with, like, the sheriff's department and the police departments of providing naloxone when people are released. So this is snowballed into all over the community.
In a good way.
Yes.
Snowballed in a good way. So you kind of led me to my next question. I'm going to ask it anyway, but I think I have a general answer. So it sounds like, besides the law enforcement, the sheriffs and police officers and whatnot, those public officials, it seems that you guys would encourage not just them, but members of the regular public to carry Narcan on them just in case of a situation. Would I be right to assume that?
Yeah, absolutely. Like I said, you should be trained on it, but think of if I had a CPR training or I had first aid training and I saw somebody who was in danger. If you're certified, your job is then to help the person. So this is the same thing. It's just a different emergency that we're helping. But yeah, everybody should have one. I throw them at people I know and say, hey, just in case you might need this. So go ahead. Mm-hmm.
Yeah, we've had a lot of movement with placing naloxone in AED containers in various establishments as well. So kind of getting that stigma away and also lumping it with any other medical emergency. And so same thing of we have a commitment to our community.
So the stigma thing has come up a few times in this conversation, and I think it's important to say that, if you are carrying Narcan or you are encouraged to carry this around for the public, there could be some stigma kind of attached to that. If you were to go to a health fair or something like that and they're offering Narcan, kind of like what we do at the health department at our fairs, there may be some people that are a little hesitant to maybe grab that because it may say something about them or give off a certain kind of impression. Like, if you reach for the Narcan and you take that, maybe you're saying that you are someone who struggles with a substance abuse, and that's just not necessarily true, right?
No, not true.
Okay. No, totally understand that. Let's move on a little bit and talk a little bit about the monthly root meetings that you guys hold. So you host monthly meetings. Can you tell us a little bit about when and where these happen?
So the second Thursday of every month, Hub Coalition, who we are under, meets at 8 o'clock at the Porter County Community Foundation, which is open to the public. Anybody can join. We're a coalition that is, again, working on the substance use prevention and education. And then directly following that at 9 o'clock, we meet for root. So most of us are in the county level, and then we stay together and do the root committee. Again, open to whomever. You're welcome to join us.
What takes part of these meetings usually?
This is where the think tank happens.
A think tank.
This is where, what are we going to do? We were just talking the other day. It's a great group of people. That's, again, one reason why I got pulled in this direction was the people who brought me to the work. And the email chains that we have going, we just had a discussion at our last meeting. We got to find something more efficient instead of our emails blowing up with these chains because all the work that we're doing. So it's really just collaborating in between meetings, making the list, and then what work are we going to get done? It's busy work every time. We're super efficient every time we meet because we are able to communicate in between. So I think the strength of the team we've built has also made this quite successful as well.
Okay. Anybody have anything to add to that? What takes place at your monthly meetings? I think that's some good information.
I think one of the things I would say is I think what's really important, we've got a community member that is just come to our meeting and wanted to learn something about this. If there's people out there listening that have family members, you're wondering, how can I be of help to somebody that might struggle with addiction? Maybe you're coming and you're just asking some questions. And so in this meeting, I believe we, create a safe space, right, where conversation can start to happen. Initiatives come out of those conversations with followed up by some goals and some direction. And, that's where this all started, right? When we think about 4 years ago, this idea of, well, what do we do now? And this idea of, well, what about these nalox boxes? And the stigma and the resistance that we met initially with putting these up, how that has shifted after 4 years of work, 23 boxes later, with people saying, hey, I have a location that could use a box. Valpo University, right? We see areas where they're putting a box where it's, it reduces that stigma. It doesn't mean, it just means there's a resource available for an emergency intervention. And I just quickly want to say, I think the trainings are so important because it develops a sense of confidence. I think if anybody listening on this call is walking down the street and you saw someone on the ground, would you walk over to help or would you just keep walking? And if you did walk over and you saw that they were unresponsive and they had the pinpoint pupils and maybe they exhibited signs of an overdose, what would you do? Would you have Narcan, in your purse, in your pocket, on your person, and would you know how to use it? Well, certainly I think that's where these trainings come in. And, conversations in our meetings, I think, address all of this. But some of the recent discussions have been, how can we get the word out now? We have a structure in place. We've got 23 boxes. Do people know where these boxes are, how to access them, and how do they get trained? Right? And so we thought about, well, who can we collaborate with? And certainly WVLP is an active coalition member of the Hub Coalition. And this is what, came out of those conversations. Perhaps it's a podcast, followed up by a PSA announcement. I mean, because people have to know how they can access this if they want to make a difference and be part of the solution as opposed to part of the problem. So, we're very solution focused, but we need new ideas and we need perspective, which I think ultimately leads us to, providing better resources. And that's what happens in these meetings that we meet once a month. By the way, it's 8 a.m., okay, not 8 p.m.
Oh, did I say p.m.?
You did not say p.m.
I'm naturally a night owl. See, I hate the mornings. It just shows naturally.
If I'm a listener and I'm hearing this at 6 p.m., I might think, I've got 2 hours to get to the meeting.
Well, I'm glad
it is 8 a.m. And so if you want to learn more about what we do and you want to be actively involved in the volunteer process of making a difference in the community in this way, we welcome you. Yeah.
I wanted something you said remind me of something that I forgot to mention. The Aaron's Law we should talk about. Because when we talk about Narcan, and I'm telling you, like CPR first aid, I have a certification typically behind me, and I have protections, the Good Samaritan Law. So if you have those questions or concerns, look into Aaron's Law, AARON, and what is covered under that Good Samaritan Law, and what is appropriate and not appropriate for you to be considered a Good Samaritan in one of these situations, if you have any concerns.
It's important information right there. Thank you so much for that.
One thing quickly, sorry. No. I want to say what also happens in these meetings are we go through all the boxes. Are they covered? Do they need refills? Is there anything that's needed at any of these locations? And individually, Samantha does a lot of the movement to get these boxes full, as well as Alyssa. Everybody has assigned locations where they're responsible for staying in touch, making sure the boxes are not they're visible and they're full. And that's another thing that we do, for accountability purposes in the Root Committee meetings.
You guys are a well-oiled machine, very organized with these Narcan boxes.
Yes.
So let's talk a little bit about how to get the public involved. So how can someone in the community get involved with Root? Do they need to be a healthcare professional, or what's criteria do they have to meet if they want to join Root?
Do you want to make a change in the substance use world? That's really all it is. If you've got a passion, or even if you're interested and want to just come listen. How Scott had mentioned, that's how we have one of our Root Coalition members right now, is she was just somebody looking for some information, came to a meeting, liked what she saw, and then she even became more involved and joined our committee. So we're a great group of people. Come join us, see what it's about.
What kind of volunteers or partners are you looking for? Are you looking for people who may have some kind of experience with battling substance abuse issues? Are you looking for young people, the older demographic? What kind of volunteers and partners are we looking for?
I will say youth is always one that we're trying to look for.
That's
youth
important.
is hard to grab. Mm-hmm. They're busy. They're growing. They're doing school. They have all the things. But that's where a lot of it starts. Again, what is that root? What is that thing that happened? And really getting with our youth to understand the struggles and whatnot to help those preventative things that sometimes lead to that substance usage.
Yeah, and so overall we have 12 sectors of a community, and we're always looking for representation from all of those 12 sectors. So you can always Google what are 12 sectors of a community, and see where do I fall in? Am I a parent? Am I a youth? Am I a faith-serving organization? Am I in the healthcare field? Am I just a community member? And we're always looking for those 12 sectors to have an active say, because that's how we get the whole community involved. Nothing about us without us. We don't want to put something in the community that we don't want, but we need representation from everybody to figure out where does this go, or how does this evolve, and how can we grow in a way that everybody is comfortable with. Because we talk about in trainings, harm reduction is this big spectrum, and it looks very different across all of the U.S. So we're not pushing anything from the West Coast or the East Coast into Porter County, but we need to have these discussions and talk about them together to figure that out.
Understood. We need people from all demographics, because this affects people of all different demographics, all income levels, all that stuff.
Yes.
So let's talk a little bit more about the collaborative efforts in the community. So the Root Committee works with a lot of different partners, law enforcement, schools, mental health providers. Scott, how important is collaboration to the success of the mission of the Root Committee?
Well, I think collaboration is key. I think it's top on the list. We can't do this alone, and certainly people, law enforcement, schools, mental health providers, individuals who might be not working at this time but are inspired and want to give back and make a difference. All of that, I think, is so important to our mission, because Root is reduce opioid overdose together. We can do it together if we work together. And I think, sharing ideas and experience is really important, especially through the lens, whether it's through law enforcement or schools, or how we can be more effective and work in partnership with these groups, because we can't put this all on one group or one sector, expecting that, the healthcare providers, well, that's their job. No. Well, it's law enforcement, right? Because they're dealing with those, quote, drug addicts, and I think that's where we really have to reduce the stigma, because, opioid overdoses can happen with people who might mistake medication. And at the end of the day, if you are prepared and you have this intervention tool, you can save a life. And, we generally talk about people in recovery, but this is happening in other areas too. So I think, collaboration is really key. The Hub Coalition, even coming to a meeting at an 8 a.m., second Thursday of every month, you can go to Hub Coalition, our website, and you can also email perhaps one of us, and we can give you that information to attend a meeting to see what happens at these coalition meetings, which is all about making communities safer, making communities drug-free, and just having happy, healthy communities. And Porter County is wonderful. We know that, right? But we always feel that there could be just one more step, right, to help us be a little bit more free.
Yeah, and I think you can see the success through collaboration as well, because originally in Porter County there were a few boxes and they were really only at health centers. So we see now, like, through this collaboration, we have all these boxes and these conversations are happening because, like, there's boxes at Valpo University's police department, because they're at Hilltop, because they're at the YMCA's. So we see the difference that's happened from thinking, oh, these people can take care of it, they're a health center, to, like, look what happens when we collaborate as a whole. Now all these conversations are happening, these boxes are being placed. Yeah.
Understood. So if I'm hearing you guys correctly, it sounds like you're saying it's basically going to take a team effort to root out opioids in Porter County.
Teamwork makes the dream work.
That's right.
We love the pun. We love the pun.
I live by it, okay?
If you need a PSA, let me know. I'll write one for you. Let's talk a little bit about moving forward and future goals, if you will. What are some of the long-term goals or upcoming initiatives the Root Committee is working on?
So I can talk a little bit to that, because we just worked on some funding. So we're actually working a little bit on deepening the education of our committee as a whole. So we're all taking additional trainings, making sure that we're up to date on naloxone, on stigma, and initiatives that we can bring into the community. So right now we're focusing on deepening the education as a whole, bringing that education to the community, getting more nalox boxes, securing naloxone for the future, and then also working on how we can provide more of those trainings to our community. So the naloxone trainings, anti-stigma, harm reduction, any of those. And so if anybody in the community is interested in one of those trainings, that is something that we can provide, whether they have a nalox box or not. Or if they're interested in more information on a nalox box, we could also do that as well. And then we also have some other long-term goals of, like, getting the word out about the boxes we already have, how we can better serve the community. What else would you say, Scott?
I would say there's health fairs coming up. In fact, I believe the Portage...
June 13th.
June 13th, the Portage...
Porter County Health Department.
Correct, having a resource
Oh, yes,
fair.
you're talking about our health fair. Yes.
So there you go, a little plug for the health fair. But it would be at an event like that where maybe we would have a table and we could have a flyer that actually has the locations. We have QR codes. We're investing in stickers that can simply go on water bottles, scan the QR code. Before you know it, you've got all the information right on there on how to recognize an overdose, perhaps how to respond to it, where you can access the resources here. So anything we can do to bring more awareness to what is available, along with more trainings, because guess what? None of this gets done for free, and nobody's really donating money for that cause. Mm-hmm. So we have to apply for grant funding, and by doing so, you have to meet certain metrics, and you have to show that, yes, there is a problem, and we do have a solution that we want to put some effort behind. And so I do really think it's important that we're involved in much of that right now. As we said, we've got some structure in place with the boxes. We'd love to see more boxes. If there's anybody out there that feels like having a box up in their location, would provide access and a resource for the community or the people that might, Valpo Y, for example, there's a lot of foot traffic that goes through the Valpo Y.
Yes.
We did a training there. And you know what? The room that we were in, we must have had 40 people show up for that training. So maybe that's 40 people, young people, middle-aged, whatever the case may be, different demographics. At the end of the day, you've got 40 people that walk away armed with more information. And when people walk by that box, maybe they don't see it, maybe they see it, maybe they're inquiring within. But then there's an opportunity, right, for us to, just get the word out and reduce stigma and let people know that it's okay to carry Narcan, because in the event that, you might see someone that needs help, you could be that person that might make a difference.
Mm-hmm.
Yeah, and I know we're also trying to expand to all of Porter County. So we have quite a few boxes in Valpo and Chesterton, but we just started getting over by Hebron, and areas like more rural areas. So we're also trying to expand, but we need more contacts. So looking for community collaboration with that of like, oh, where can we place these boxes where we don't have boxes, and community members that maybe aren't in Valparaiso that would like to join the committee, because we also have options. We're starting to do a Zoom option sometimes for our meetings as well. So if there are people that are in a more rural area, we really want to expand as well, and we can figure out a way to make that work too.
Absolutely. We're trying to include everybody, right?
Yeah.
Let's talk a little bit about community resources. What other local resources would you recommend for people who want to help with addiction or want to support a loved one who's going through this situation?
Well, I know from the mental health side, 988 is always a good one. They are 24/7 to contact a one-on-one person to coach you through. People sometimes refer to it as like the suicide crisis line. You don't necessarily have to be suicidal to call if you are in crisis. This is a line that's 24/7 for you to contact to help walk you through that. We also have 211 phone services. One thing that I love about Porter County, I came from Lake County and I've loved it since I've been here. I still love Lake County, but one thing we have that we've done out here, which is great, is through the collaboration with the health department, is create our own findhelp.org section. So if you go to portercounty.findhealth.org,
yes,
you will be able to look at categories. Is it housing? Is it substance use? Is it food assistant? Is it childcare? And find resources that are in our area specifically, because we have a move it going of making sure that those places are contacted and that information is up to date for people, so that if they do need resources, they have somewhere that they can go. Because it's frustrating when you're like, I look online and these people are closed, that person's closed, that number doesn't exist. So it's a big thing that we're trying to do here in this county to make sure that we have the resources, they're out there, and they're accurate.
Understood. If we can go back a little bit and talk a little bit more about the 988 hotline, what can people expect when they dial in? So you said that it's not just for those who are going through a crisis where they may be suicidal or something like that. What can people expect when they dial into this hotline?
So when you call, you are connected with someone who is trained on how to de-escalate a situation and try to calm you. So they talk to you with what you're presenting. So what is your crisis? What can you share with them? And they're a trained professional to be able to help de-escalate that and find out, okay, what's going on? What do you need? What can we do? And maybe that's like talking through where we need to go, who do we need to call? Because when you're in that crisis, your brain is not critically thinking. It's fight, flight, or freeze. So that number is someone to help talk you down and help you to be able to think more clearly and have a plan of what to do.
Understood.
Yeah, and I know we also have a few in-person we have quite a few in-person resources in Porter County, which is something that is to be noted, that with the opioid epidemic, I do believe Porter County has been very on point with trying to meet the needs of our community. But we work with Porter Stark. They have great services. HealthLink has a great service that provides peer recovery coaches, and amongst some other community partners that we have that all do really great things in the community.
It's all about those partnerships, right?
Yeah.
Teamwork makes the dream work.
See, now you're saying it.
I know, you got me saying it now. Well, guys, we've talked a lot about some serious content here today, a lot of ways to help people in Porter County, a lot of good information here. But as we close the show, I thought it'd be nice for us to have a little fun. So I have a few questions here that I purposely did not send to you ahead of time because I want to know what you think about these just off the top of your head. So if you don't mind, I'm going to jump right into these, all right? We can go whatever order we're going to go. So this big topic online, it's been going on for like 2 weeks now, so we might as well jump in on it too. Who wins, 100 men or a gorilla?
The debate.
It's all over the place. Let's start with you, Scott. What do you think?
The gorilla wins.
Really?
Yes.
It's pretty short and sweet.
I believe the gorilla wins.
That's where all your money's going?
That's where all my money's going. If I'm one of 100 and I see a gorilla, I'm turning around and going the other way.
What if they're like big Brock Lesnar, UFC type dudes? Are you still leaning that way?
Still leaning that way.
Yeah.
Not taking my chances.
Samantha, what do you think?
I
You're a
like-
risk taker. What's your money on?
Okay, well, I've seen all the AI generations, and I'm thinking the men would win. But I like the variation of one man versus 100 angry Latinas.
I haven't seen that. Wow.
But no, you know what? After extensive research, I'm thinking the men actually.
Really?
Yeah, I'm surprised. Yeah, but I don't know. I've seen a lot of AI reenactments at this point, and the men win at the end.
A 500-pound silverback gorilla versus 100 men. Average weight of men in America, I believe, is about 170 pounds. So times that times 100. And of course, one man does not equal the force of a gorilla. But you're saying 100 of them, they're going to take down Mighty Joe Young, huh?
I've always had too much faith in men.
Oh, wow. All right. Alyssa, have you thought about this? Have you seen this online? Have you contemplated
This
any
is
of
the
this?
first time hearing of it, but
No?
it reminds me of the whole man versus bear, which one you'd be safer with. So remember that was the whole thing with my
Yeah, that was a whole thing too.
Safer, but I do not know this one.
No?
Nope. So now I'm going to go look into it, what you guys are talking about.
Like Samantha
Yeah.
said, there are a lot of animations online kind of showing this whole breakdown of what would happen or what is likely to happen. Okay, so I have a scenario for you. Which is more scary? So you're walking through the woods, you got to get to your campsite, and it's 2 miles away. It's midnight. It's pitch black. I don't know how you got in this situation, but you're there. So which is scarier? Walking back to your campsite, or if you had to swim maybe on a surfboard or something like that, you're 200 yards from shore in shark-infested waters. Which is the worst situation? Let's start with you, Alyssa.
I hate water. As soon as you said water, I was like, I don't care what it is. I don't like, if I can't touch the bottom, I don't like it. So, no, I'll go through the forest just fine.
Okay, midnight stroll through the woods.
If over sharks, yeah. I used to have a reoccurring shark dream as a kid. But,
Oh, no.
Yeah, no thank you.
So you have a real fear of water, huh?
Yeah, not with sharks. No thank you.
Hope we didn't trigger you with this topic.
No.
I know a mental health service for you.
We have help. Samantha, what are you doing? Which is
Okay.
less scary to you?
Honestly, I feel like I've been in like both these situations already
What kind
because
of life do you live?
I know, but I camp a lot and I paddleboard, and I refuse to paddleboard at night because you don't know what's in the water. So
Right.
I'm choosing the long walk through the woods.
Really?
Yes, Little Red Riding Hood over here.
There could
I'll
be
be okay.
bears out there. There could be packs of wolves, Bigfoot.
We don't know what's in the water.
That's
That's
true.
way more scary under there.
I've seen Sharknado.
Don't they have like 6 or 7 Sharknadoes at this point?
Yeah.
They've made quite a
It's
few. I've only
expensive.
seen the first one. Scott, which is less scary, the woods or the water?
Well, okay. So the question is the silverback gorilla in the woods?
No.
500-pound gorilla.
I should have preferenced the location. We are thinking America, Northwest, Oregon,
Okay.
Washington area. You know, the redwoods.
Okay.
Yeah.
No problem walking in the woods.
No?
Put me in the water, shark-infested waters, forget it. I'm a product of Jaws. I saw that as a kid, and it changed everything. So,
You know, they say if you're in the water with sharks, all you have to do is not freak out. Like, just don't panic. That's what I heard.
interesting.
Yeah.
They don't
So
look
if you're not just
trustworthy.
splashing about like an injured fish or a seal would, you might be okay.
Until it bumps you.
Yep. That is how sharks taste. They rub their skin up against your skin. That is how they see if you're edible or not. Did you not know that?
No, we're
Yes.
gonna walk. We're gonna hold hands through the woods.
Okay.
We're good.
No
So
water
we're
here.
walking through the woods.
We're walking through the woods following Samantha with a Little Red Riding Hood cape. She's got this.
Carrying a picnic basket to
Packs a
grandma's
mean
house.
punch.
That is awesome, guys. I just have a couple of more questions here just to have a little more fun. So one of my favorite shows, I believe it's on Animal Planet, Animal Fight Club, where you see all these different animals kind of fighting each other and whatnot. So I wanted to put this scenario out there to you guys. Now, who wins one-on-one? Grizzly bear or that same gorilla that we talked about earlier? Gorilla, grizzly bear.
Grizzly bear.
Grizzly bear?
Gorilla.
Grizzly bear's got the claws.
They have the
And
claws.
he's got the bite.
But a gorilla can punch, though. You know, they've got that oomph.
This is true.
One good hit and that bear is down. I'm going with the gorilla. You just
Okay.
got hit in the right spot. That gorilla. Mm-hmm.
That's true. And I feel like gorillas are a little more loud as well. They'll shake tree branches and, beat their chests and all that. And I feel like that might scare the bear off, honestly. I don't know. These are the things that I think about when I'm laying in bed and I can't sleep. These are the scenarios. So I just wanted to put them out there to you guys. Okay. I have one more scenario before we sign off here and close the show. This one is particularly special to me because I love whales. I grew up loving whales. My teachers thought that I was either going to be a marine biologist or I was going to work in broadcasting. Turns out I worked in broadcasting. And pretty similar to what I'm doing now. So, this last scenario I'm going to lay in front of you. Who is the king of the ocean? Who wins? A great white shark or a killer whale? Jaws or Free Willy? Scott.
Free Willy.
Free Willy?
Free Willy. That shark's got to take quite a few bites to hurt that whale. I think that whale's going to win.
My mom just went whale watching in Hawaii, actually.
I'm so jealous.
It was huge. The videos were insane, so I'm going to have to go with the whale. Yeah.
I've gone to Oregon just about every year on the coast for the past 7 years, and I can never find a whale. I think I'm going the wrong time of year or something.
Yeah, you're going at the wrong time.
So I grew up at when SeaWorld was really popular and cool, so the killer whales were just kind of fun. So I don't know how to see a killer whale as a killer whale.
Oh.
They just are like, oh, they're giant and they're pretty. But so I don't know.
They are nicknamed the wolves of the sea.
See, but they're so cute.
Wolves are cute when they're little.
Yeah, they just gotta keep their distance and all.
Yeah, but you don't want to be that person walking at midnight through the woods to get back to your camp spot,
So I can believe it might be the killer whale. I just have a hard time looking at it.
You're going with the shark.
Sure, just because I like the whale.
Just to switch it up a little.
Yeah, sure, I'll be different.
Yeah.
Guys, we're about to close out. So, are there any final thoughts? If there's one thing that you want listeners to know about the conversation that we had about the Root Committee or opioid prevention here in Porter County, what would that be? Let's start with you, Scott. Any closing remarks on our topic from earlier?
Yeah, what I would say is be prepared, change a life, save a life, make a difference.
Samantha?
Well, we can't help someone struggling with substance use if they're not with us anymore. So I think it's very important that we recognize that and we're proactive, and that a lot of this is just trying to be there for community members because, that's someone's daughter or mother or aunt or brother or loved one, and somebody cares about them. Yeah.
Any closing remarks, Alyssa?
Just how people can get together, and if you have a common purpose, the work that you can really do is incredible, which I wanted to use our last closing to thank the other people who are on our committee who do this work with us. So we have Angela Weiner, who is from Porter Stark. We have Carrie Higgins, who is the head of the Tobacco Education and Prevention Coalition out of Valpo University. We have Carrie Honeycutt, who works for the health department. Joe Epperson, I'm not sure where he's at right now, but I know he works in recovery.
Recovery Centers of America,
That's where he's
Indianapolis.
Gotcha.
We have Greg Sims, who does a lot with the Suicide Prevention Task Force. And we have Terry Henson, who was our community member who happened upon us and stayed.
And we must remember Dawn Pelk.
Dawn Pelk, our executive director of Hope Coalition. Yep.
Okay.
She's the lady in charge.
Oh,
So
yeah.
all of them, it's the people that make the work happen.
We appreciate those shout outs. And like you said, it's teamwork that makes the dream work for all these initiatives that we have going on. Scott, Samantha, Alyssa, I want to thank you for your time today, for sharing your knowledge and your expertise right here on the PoCo Wellness Hour. Thank you so much for your time. As we close out, do you have any websites or phone numbers where people can get a hold of you at?
So I am on the leadership section of mhanwi.org for Mental Health America Northwest Indiana, and my name is Alyssa Zills, the Porter County Program Director.
My email is so I'm Samantha Aguilar. My email is saguilar@hubcoalitionpc.org, and our website is hubcoalitionpc.org.
Feel free to reach out to me. As I said, my position with Gateway Foundation, www.gatewayfoundation.org. We provide resources for treatment services. If you want to reach out to me directly to get you connected with the Hub Coalition Root Committee, SEJANSON at gatewayfoundation.org. Happy to get you connected. Thanks.
Thank you so much, everyone. We really appreciate your time. As we close out our show, let's talk about a couple of upcoming events that we have going on. The Porter County Soil and Water Conservation District, they're hosting a free summer learning series. Next up on this series, all the stink on septic systems. That's all the stink on septic systems. That's taking place on Wednesday, May 28th from 6 to 7:30 p.m. Central Time, taking place at Ivy Tech Community College in the auditorium. The address there, 3100 Ivy Tech Drive, right here in Valparaiso. Featured speaker for this event, our very own Dan Boyd from the Health Department, our Environmental Health Director. If you want to learn more about the basics of septic installation, maintenance, and more, this meeting is for you. Make sure you register by May 21st if you want to attend this meeting. The best number to reach out to is 219-462-7515, extension 3. That's 219-462-7515, extension 3. Make sure you register by May 21st to attend this May 28th event. And as we mentioned earlier, on Friday, June 13th, from 11 a.m. to 3 p.m., join us for the second edition of the Summer Kickoff the Health and Wellness Family Fun Fair at Central Park Plaza in Valparaiso, hosted by the Porter County Health Department. This free event is back for its second year with vision and dental screenings, immunizations, school physicals, heart screenings, free haircuts for the kids, and a bunch of giveaways, face painting, and more. It's a perfect way to start your summer healthy, happy, and ready to go. That's Friday, June 13th from 11 a.m. to 3 p.m. at Central Park Plaza. We'll see you there. And for more information on upcoming events and programs and initiatives that we're a part of, please visit our website. You can find us at the Porter County Government website at www.portercountyin.gov, or you can go straight to our Health Department webpage, www.gov/local health/Porter County, or you can find us on social media. We have an X account, which is x.com/county_Porter. You can find us on Facebook, facebook.com/Porter County Health DEPT, or you can find us on Instagram at Porter_County HD. This is Demetrius Lewis, Communications Manager for the Porter County Health Department, signing off and thanking you for tuning in to yet another edition of the PoCo Wellness Hour, right here on WVLP 103.1 FM, your show for health, community connection, and overall well-being. Have a healthy and safe week, everyone. Peace.
Scott Jansen with the Hub Coalition of Porter County here today to bring awareness to the Root Committee, Reducing Opioid Overdose Together. Do you carry naloxone? Naloxone can save lives by reversing an opioid overdose by blocking receptors in the brain within 3 to 5 minutes, yet poses no harm to others, even children. Being prepared to respond rapidly, support friends, family, and others who may intentionally or accidentally misuse opioids could save lives. Even your elderly loved ones may accidentally overuse a medication. Free naloxone is available to the public at over 23 locations throughout Porter County at the Nalox boxes, thanks to the efforts of the volunteers working to reduce opioid overdose together. Visit hubcoalitionpc.org to find a Nalox box nearest you to get your free naloxone today. This PSA was developed in part under grant number 5H79SPO82604 from SAMHSA. The views, opinions, and content of this publication are those of the authors and contributors and do not necessarily reflect the views, opinions, or policies of the Hub Coalition and should not be construed as such.